Hi, good morning, Neil. My name is Stella Border. I'm your invigilator for the OET speaking session on the 2nd of June 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Neil Morphy.
And what is your candidate number, please?
My candidate number is 235349197.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
The field of nursing consists of interprofessional collaboration and teamwork. Describe a time when you worked as part of a highly diverse team.
To maximize employee health in our hospital, recently implemented a variety of wellness strategies, from yoga classes to nutritionist-devised meal plans. As part of the meal planning, a steering committee was assembled from across all levels of staff, nurses, aides, administrators of various sorts, caretakers, and even directors were recruited to contribute and ensure that the choices made reflected the diversity of our team at all levels. This diversity brought a wealth of important insights and also some challenges. Each of us offered our own ideas for possible meals, personal favorites, and dishes from our various cultural backgrounds, and we came together with a staff nutritionist to work out the details to maximize nutrition and flavor while minimizing cost.
Nurses often complain about long shift work hours. What is your view on this?
Any career that requires long hours with little rest is going to leave workers prone to burnout. However, acknowledging this problem and tackling it head-on is the first step toward mitigating the effects of such stress. Many of us are passionate about our positions, and that passion is important, but it takes realistic, pragmatic efforts at self-care to keep burnout at bay. I've already spent some time working in healthcare establishments, and I've been fortunate to see firsthand some of the in-house steps some institutions are taking to counter this problem. On top of this, I've developed my own self-care tactics. I have a very strong relationship with my partner, and my family and I are close. Though they don't live here, we talk via Skype on at least a weekly basis.
Describe a time when you were faced with a situation that challenged your confidence and sense of assurance.
When I was working in the emergency department, soon after my graduation, the incident happened. It was during a short staff day. Suddenly, there was a rush into the department following a road accident. We have to provide first aid and transfer the critical patients to the corresponding sector for necessary treatment. Seeing patients in pain and in blood, and the requirement to act spontaneously, stopped me for a moment. However, the head nurse was very supportive and guided me through the entire shift and was ensuring I am doing all good. Thus, I accomplished the confidence and overcame the fear of the medical emergency.
How do you deal with a particularly demanding patient?
I stay focused on the patient's needs, and I do my best to not take any disparagement personally. I understand that a patient's attitudes may be colored by whatever pain or condition is afflicting them. During my last job, as an RN at a continuously busy hospital, I faced many difficult patients. It came with the territory. But I realized that most of them were not being difficult, just for the sake of being difficult. If you treat them with respect, sitting down to speak with them, taking the time to listen carefully to their needs, despite your tight schedule, you'll be able to find a solution.
Do you work well under pressure?
By nature, I'm very even-tempered, and that has given me strong foundational protection against stress. I also practice mindfulness and meditation daily, which has helped to further strengthen my mind. Additionally, I'm a runner, and I've found that jogging a few miles every weekend always helps me to clear my head and brace myself for the coming work week. And recently, I attended a symposium on workplace stress, which taught me about stress reduction techniques, such as taking walks during my lunch breaks to avoid burnout.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Good morning. My name is Neil Morphy, one of the community health nurses. How may I help you today?
Good morning. My GP has informed me about the chickenpox vaccination for my child. So I am here to inquire about the chickenpox vaccination.
Oh, I see. I am glad to help you with the information. Well, before proceeding further, how may I address you?
You can call me Stella.
Hi Stella, I really appreciate your effort to be here. By taking vaccination, you are protecting your loved ones and others in your community. Stella, now, I will explain about chickenpox.
Okay, nurse, you may please.
Chickenpox is a highly contagious disease caused by the virus called the varicella zoster virus. It causes an itchy, blister-like rash. The rash appears first on the chest, back, and face, and then spreads over the entire body.
Oh, really?
Yes, Stella. Also, the patient may feel fatigued, have a fever, or loss of appetite, along with headache, itching, sore throat, or swollen lymph nodes.
So, by taking the vaccination, can it prevent my son from getting the disease, and be on a safer side?
Exactly. Chickenpox vaccination is also called varicella vaccination, and can protect your son from the disease. However, it is also possible for a person who has been vaccinated for chickenpox to develop chickenpox at some later point in life. Even so, the disease is almost always milder and the recovery is more rapid than for people who have not had the shots.
Okay.
Perhaps, it is important to keep in mind that up to 90% of the people who get the vaccine will not catch chickenpox.
All right, I understand that, nurse.
Moving on, let me explain to you about the vaccination program.
Of course, I would like to know about it.
I appreciate your interest. Stella, it is recommended to have 2 doses of chickenpox vaccine for children, adolescents, and adults who have never had chickenpox and were never vaccinated.
Okay, nurse.
Children are routinely recommended to receive the first dose at age 12 through 15 months, and the second dose at age 4 through 6 years.
My son is a 15-month-old, nurse.
All right. So your baby should get his first dose now.
Sure, nurse. And the GP has informed that children should get protection against chickenpox, as this may cause shingles in the latent stage. But I didn't get that point.
What your GP has informed you is correct. I will explain it to you for a better understanding.
That will be of great help, nurse.
Stella, the same virus that causes chickenpox also causes shingles, but they are not the same illness. Shingles result from a reactivation of the virus, long after the chickenpox illness has disappeared.
Is it? How does it happen?
Your question is sensible. It is just because the chickenpox virus stays in the body, even after recovery. Later in life, the virus can reactivate and cause shingles.
So it is something to be taken care of.
Yes, Stella, you are right. Moreover, if you have shingles, you can spread the varicella virus to people who have never had chickenpox or never received the chickenpox vaccine. These people will develop chickenpox, not shingles.
Okay. Now I understand the connection between chickenpox and shingles.
Good to hear that, Stella.
Nurse, I do not want to risk my baby's health. Kindly help me with the procedures for his vaccination.
Stella, try not to worry. Definitely, I will help you with the procedures.
Okay.
I can schedule an appointment for the vaccination at the earliest, so that you can bring your baby to get it, and thus, he will be safe from the virus.
That is so kind of you, nurse.
It's my pleasure, Stella. Also, for further reference and better understanding, I will provide a patient information leaflet.
Thank you very much, nurse.
You are very welcome. I hope to meet you on the day of appointment. Always feel free for further queries.
Sure, thank you. That is the end of your OHE speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.